Welcome to another edition of the DAMY vlog. My name is Dr. David Duizer. I'm a naturopathic doctor focused on the prevention and holistic management of chronic diseases. Today on the show, we're talking about the heart attack gene, 9p21. If you're not familiar with this, I'm glad you're here. It's a really important gene to know because 2 SNPs confer risk of heart attack and stroke. We're talking about some variants of this gene that are extremely common in the general population that increase the risk of heart attack and stroke, specifically the risk of early MI. We're talking about heart attacks before the age of 50 for men and 60 for women. This is an important gene to know about. The number 1 killer of North Americans is cardiovascular disease, and we are very familiar with the risk factors that predispose us to heart attacks and strokes already. But what we may not know about is what we're getting from our family history, what we're getting from our genes, and what we can then do about it. You may be thinking, if I have this gene or this expression of this gene, what's the point of knowing because there's nothing I can do? Well, I'm here to tell you that we can track biomarkers and reduce them using lifestyle modification, supplementation, and medication to make sure that they stay in range and to make sure that the risk is reduced. So 9p21, this gene, when you have 2 SNPs two copies of the SNP that confer the risk of heart attack and stroke, that's called a homozygous variation. Your risk of a cardiovascular event before the age of, or an early MI, an early heart attack, is doubled. That's the exact same as the risk that is conferred for smokers. So we, as a naturopathic physician, we want to know when a patient smokes, right? And as a person who smokes, you know that your risk of cardiovascular disease is increased. You just know that because it's just well documented. But therefore we consider that significant. We should know if someone has this variant on this gene because the risk is exactly the same, and we need to do something about it. We need to make sure we're tracking all the required biomarkers. And I'm not just talking about LDL, by the way. So what do we do? Okay, so we think it's important to know because it's exactly the same as smoking for people who are under the age of 50. In terms of risk, well, what do we need to know? Well, we need to know LDL cholesterol, of course. We should know either LDL particle or ApoB100. We should know the significance of the LDL cholesterol number. We should know homocysteine. We should know vitamin D status, omega-3 status. We should definitely know LPPLA2. The LPPLA2 activity, the marker of inflammation in the cardiovascular system. A hot cardiovascular system or inflamed cardiovascular system increases the risk of cardiovascular disease and acute MI. And when you have this gene variant, LPPLA2 can go up, and it really does need to be suppressed. So in knowing that the risk is high, in knowing that you have 2 copies of this gene, it's important to track markers, do therapy to keep those markers normalized, and therefore reduce your risk of a cardiovascular event. So, I think it's really, really important to be tested to see where you stand with this SNP. There is another potential case here. What if you only have 1 copy? Well, guess what? 50% of the population has 1 copy, and their risk is increased as well. Not as significant as if you have 2 copies, but still significant. If you have 2 copies, I mentioned that your risk of early heart attack is the same as for a smoker. That's 2 times the normal population risk, or a relative risk of 100%. But what about for other things? Well, for lifetime heart attack, the risk is increased by 56% or 1.5 times the normal population. So that's significant as well. So we're talking about a very large percentage of the population walking around with a significant risk of a cardiovascular event, and most of it driven by this one gene. So we need to know this gene status. So, in clinic, we find it out, then we do some assessments, we do a cardiovascular profile, we do some treatments. 3 months later, we do that profile again, and we see what kind of a risk modification we've had with the biomarkers. We don't need to test the genetics again because they're going to be the same. But what kind of things can we do? Well, you're probably familiar with omega-3s conferring some benefit and risk reduction of cardiovascular events. Vitamin D status is very important. We have herbs and supplements that can keep cholesterol low, for example. And then, of course, we've got a series of medications that can keep cholesterol normal and therefore reduce the risk. So there are lots of things that we can do on the supplement and medication side, but lifestyle modification can dramatically reduce the risk as well. We're talking about alcohol restriction in certain circumstances. We're talking about dietary change in certain circumstances. These things can all be helpful in the reduction of LDL cholesterol. They can be helpful in the reduction of LPPLA2, homocysteine. All of these biomarkers important in the reduction of cardiovascular disease. They can be altered by lifestyle, and that's what we love to do in naturopathic medicine. But first, I really do think it's important to know 9p21 expression, because it really is the heart attack gene. When you have the variant that confers risk, which is the homozygous presentation in 2 copies, is 23% of the population, it is important to make sure your biomarkers are normal and to make sure that your risk is reduced in that fashion. Thank you so much for watching. If you have questions about holistic, integrative medicine in general, please post them in the comments below. If you like videos like this, subscribe. We'll do more of them. This is one in a series of cardiovascular videos that I've done. I'm going to continue doing them because I'm passionate in this area. Thanks for watching. Have a great day.